Good afternoon, everyone. I'll be presenting a case report on Rhino Orbital Mucormycosis. Rhino Orbital Mucormycosis is a rare but life-threatening infection that generally occurs in patients with diabetes mellitus and other immune deficiency conditions. It is of two forms, Rhino Orbital and Rhino Cerebral forms. Early recognition and treatment are essential as the mortality rate is 30 to 70%. A patient, 39-year-old male, presented to Ophthalm OPD with sudden loss of vision and ptosis of right eyelid since 3 days. Patient was also a case of uncontrolled diabetes mellitus. On right eye examination, visual acuity was negative for perception of light. There was presence of complete ptosis. Corneal sensations were absent, and pupil was 7 mm, fixed, non-reactive to both direct and indirect light reflex, and complete ophthalmoplegia was present. Posterior segment examination revealed established papilledema, signs of cerebral retinal artery occlusion. However, there was no diabetic retinopathy changes. On nasal endoscopy, black crusting was present in the nasal cavity, and the turbinates and nasal mucosa were atrophied. Nasal mucosal biopsy revealed colonies of fungi with two different morphologies suggestive of aspergillosis and mucormycosis, and the CT scan showed right maxillary, ethmoidal, sphenoidal, and frontal sinusitis. The patient was managed with intravitreous liposomal amphotericin B for 21 days, and he was also underwent a functional endoscopy sinus surgery with right orbital decompression with local infiltration of amphotericin B. Mucormycosis is a condition with fulminant course and a high mortality risk, with diabetes mellitus being the most common predisposing factor. The early diagnosis and treatment of mucormycosis is very important in terms of prognosis. Treatment within 6 days have a survival rate of 76 to 81%. However, a treatment delay of more than 12 days reduces the survival rate to 36 to 42%. The prognosis of mucormycosis has markedly improved over the past 30 years with a 90% survival rate. Amphotericin B has become the gold standard in the systemic treatment of mucormycosis. Before the use of amphotericin B, the survival rate of mucormycosis patient was about 6%. After the introduction of amphotericin B, this rate has drastically increased to 60%. As mucormycosis forms vascular obstruction, it may be difficult for drugs to reach the affected area. Therefore, local infiltration of infected area with amphotericin B is used in conjunction with surgery and systemic therapy. To conclude, mucormycosis remains a severe infection disease in diabetic patients, and it is characterized by a high mortality rate. It should be underlined that in diabetics, vigilance to the infections within the facial skeleton is of utmost importance. The survival rate is increased and the need for exenteration can be avoided with endoscopic debridement, systemic and local infiltration of amphotericin B, and aggressive control of underlying risk factors. Thank you.
Did he recover only along with the 21 days of liposomal amphotericin?
Yes, ma'am. Up
Did
to
he
3
recover
months.
completely?
Up to no, the ptosis and the other ophthalmic signs did not regress. Our main aim was to prevent the cerebral spread. So we wanted the patient to survive.
Why you didn't go for syrup posconazole? This is the latest one, latest antifungal which has come.
Okay.
So that is more effective than liposomal amphotericin. So along with, if you start syrup posconazole, they show a greater, good recovery along with both this therapy.
Okay. Thank you.
Usually this occurs in people using steroid inhalers.
Sorry.
Steroid inhalers for immunocompromised patients.
Okay.
Usually it occurs in that.